So we're having our first look at Kylie here. This is Kylie. She's a 6.5-month Giant Schnauzer puppy who we've had a look at today and have diagnosed a condition called OCD, which stands for Osteochondritis Dissecans. Going to have a little chat about developmental or growth related diseases in large breed puppies. As you can see, Kylie isn't too bad, but she does have OCD in her right stifle, which is her right hind leg in the knee area. Little walk again there, Elizabeth, please. Have a little look at her. Just to emphasise, folks, that Kylie isn't too bad, and we're catching this at the early stages. So just continuing our chat here about Kylie, who's a 6.5-month-old Giant Schnauzer puppy, born on the 11th of May 2024. And folks, I'm going to show you the x-rays and talk about what OCD actually means in practice. OCD standing for Osteochondritis Dissecans. It's one of a group of diseases in growing dogs, which we call a developmental orthopedic disease. In other words, it's a dynamic disease of growing bones, usually in these giant breeds at an early stage when they're growing quickly and their bones are soft. There's a genetic component in that it's inherited. Some of these dogs are more prone to it than others, but generally also lifestyle and dietary factors are part of it. In other words, they grow too quickly, they gain weight before their joints are strong enough, and then they develop a little bit of cartilage damage. Interesting thing to show you here, this is her normal stifle, her left hind knee or stifle. And one of the things to say to you here about these x-rays is even a normal knee, you have a lot of softness in the bones there. These are growth plates that are still open. There's a lack of fusion there, as you can see, in the femur and in the tibial crest. So hence the reason why these dogs can develop orthopedic disease. Their bones, their joints are extremely soft. So that's actually, as I say, the good leg. Now, let's look at the bad leg. In the bad leg, we can see a higher rate of bone turnover or bone inflammation or sclerosis in this part of the tibia, as well as the growth plate being very open. And we can see there again, bone turnover or sclerosis. The bone of the femur at the growth plate is inflamed. The bone of the tibia, tibial crest, at the growth plates is inflamed. And this is the little telltale lesion. Guys, here right at the tip of the pen, you can actually see a little bone chip, which at some stage in Kylie's life is going to need to be surgically removed. So the next stage of helping Kylie on her journey through OCD is putting together a treatment plan. And the primary and most important part of Kylie's treatment plan is going to be conservative management. And that will mean fixing the problem slowly but surely through management, patience and time. And the first part of that management, patience and time plan means we have to put together a good exercise plan for Kylie, which involves more controlled exercise, a little bit less free play, walks of no longer than 20 to 25 minutes a day, twice a day, to control the inflammation and allow the joint to become strong without any further damage. So management of her exercise. As she's a large breed, growing puppy with soft bones, we have to manage her exercise plan very carefully until she's 12 months old. That's the first thing. And the second thing is we're looking at her weight now. And although, as you saw in the first video, she doesn't look like a heavy puppy, she's 26.5 kg. I'd prefer her to be about 23 kg. So we're going to slowly but surely control her diet and control her weight and get her weight down. She's going to be a little bit ribbier and leaner looking, but a lighter body weight will put less pressure on her joints and allow the inflammation and the cartilage damage to settle down. Next, we're going to look at the medical options and discuss the surgical options in relation to what to do with Kylie from here on. So we've talked about controlling her exercise. We've talked about getting her weight down. Next, we're going to look at her diet and her mineral supplementation over the next 6 to 9 months of her life. First of all, she needs to be switched to an appropriate large breed puppy diet. And we recommend our own brand, the Gym Dog Large Breed Puppy, which is a salmon and trout based diet. So higher in omega-3, higher in omega-6. We're going to control the amount of it she eats. It'll be carefully weighed out for the target adult weight that Kylie's going to have of around 38 kg, we're going to be feeding her 400 grams max per day. 180 to 200 grams AM and PM is what that's going to mean going forward. As I say, of the large breed puppy diet, our own brand, the Gym Dog recipe, which is available on petslife.ie for online purchasing. Secondly, we recommend the addition of a good supplement. Now, these are nutraceuticals, as they're called, Nutraflex. They contain an additional supplementary amount of chondroitin, methylsulfonylmethane, glucosamine, and omega-3 and omega-6. So these are the essential amino acids and minerals that a large breed growing puppy needs for intervention at this stage of the OCD process. Next, the medical help. So the medical help, very simply, is going to consist of, at this stage, she's going to be on intermittent low dose paracetamol just for a little bit of anti-inflammatory benefit and to help with her discomfort. Her stifle joint is quite thickened and inflamed, so we want to control that inflammation and make sure that we don't have a puppy who's in any pain or discomfort, and that she's developing normal puppy habits with no distress or anxiety. So we're controlling her pain very simply with paracetamol, which is a very gentle type of pain relief. Won't do any harm long term to any of her organs or any of her digestive system. And in conjunction with that, a drug I love called Osteopen. Another brand name for this drug is Cartrophin. Now what this is it's a type of a disulfite bond which helps to promote and strengthen the development of cartilage. So to help her joint mature and become stronger, we're giving the Osteopen. Initially, she gets one shot a week for 4 weeks, and then she gets a shot every month, at least until 12 months. And then the last thing to say, there's another veterinary practice, a group of good guys in Athy, Tom Spillane and Andrew Duna, Vet Care Athy, involved in the process. And when Kylie is 12 to 15 months of age, she'll have an assessment with Andrew in vet care with a view to having the surgery to remove that little chip of fragmented cartilage which has flaked off the tibia there, as we saw in the x-ray. So we're going to delay surgery until we're sure that her bone development and joint development is fully mature. So folks, that's it for today. That's our little tutorial about OCD in large breed growing puppies. If you like this video, please do follow me on Spotify and YouTube, A Pet's Life. And like and subscribe, and hopefully you learn something from this video.